Hello and good evening. I am Dr. Bhavna B. Shinde. Welcome you all to the second episode of Autism DocTalk from Horse's Mouth. The details of this platform, the objectives and other details you can find in the link given here somewhere and also in the description box. Today's episode is going to be very special and very important because there is a very minimal awareness present in the society, not only among the general population, but also among the healthcare professionals, also among the medical fraternity. And to share his wisdom on this particular topic, we have today with us Dr. Anup Rawool. Dr. Anup Rawool has done his DM in medical genetics after completing his MD in internal medicine. So yes, DM is a super specialization done after MD. And he is one of the first MD medicine guys in India to opt for medical genetics. And also one of the handful medical geneticists we have in India today. Currently, Dr. Anup has been associated with SRL Diagnostics, Mumbai, and cancer consultant for Fortis Hospital, Mumbai. Here is a brief bio of his, a lot of publications in his name, and lot of research he has done on and achieved his status of expert as well as authority on this particular topic. When I bounced this idea of the platform, he was very keen to be on the platform, but he was available for the next week. But I, being his dear junior friend as well as an adamant one, I literally blackmailed him into doing this interview this week. The simple reason, since this episode will be released on 30th of April, which is end of Autism Month, who else would be the better choice to end this month with bang? So with this, ladies and gentlemen, put your hands together for Dr. Anup Rawool.
Hi, Dr. Bhavna. Thanks for the wonderful
Dr.
introduction.
So I think there is some connectivity issue.
No, I think I can hear you loud and clear. I mean, nothing from
Okay.
my side. Yeah.
Sorry. Let me ask you the very first question. How do you feel being the hostage? Because I literally blackmailed you into doing this in this week.
Things. The basic reason is uh, forget about the general population. Even amongst the doctor community, various specialists, say neuro, cardio, orthopedics, there is not much of awareness regarding medical genetics. So definitely, I'm looking forward to such events, such interactions more and more, which will definitely help increase the awareness of this branch. And particularly, the topic that you requested for is much more pertinent for general public, for pediatric neurologists, for psychologists, and definitely for parents who have a child or someone in the family who is affected with autism or autism spectrum disorder. So that's why I'm looking forward to this event.
Yes, that is exactly the objective for today's discussion as well. Sir, that leads me into asking you a question. Is there a link between genetics and causation of autism? So before that, I would like to give you a heads up that most of our viewers are healthcare professionals. I mean, doctors and therapists and other HCPs. And secondly, the second population which are very much into our platform is autism caregivers, the parents and other relatives
Right.
of the child or individual with autism. So, considering the wide range of population, I would request you to customize the response so that both the population would get an hint of.
Yeah. Yeah, thank you for the suggestion. I'll try to simplify things, not to use medical jargons. At the same time, I'll request you to intervene as and when I speak something like that, so as I can simplify that terms. So, regarding getting back to your question, is very important questions. That is like autism, is there a genetic aspect to it, is it inherited? Definitely, if a child in a family is affected with autism or autism spectrum, so management of that child is one aspect, but getting to know whether there could be a recurrence in next child, that is equally important, and more so creates a lot of anxiety in the family. So autism spectrum disorders, they are a group. So studies have shown that somewhere around 15 to 20% of this group of children who have autism or autism spectrum, they have some genetic or inherited aspect to it. That means it could be inherited, it could be monogenic, that means a single gene disorder causing this condition, and at the same time there could be a risk predisposition to the next sibling, depending upon whether this condition is, say, autosomal recessive, autosomal dominant, those things. So then there comes like, okay, what type of genetic disorder it is. So once you talk of genetic disorders in general, so one particular genetic abnormality at the level of DNA causing a disorder, these disorders have various aspects to it, what we call a phenotype. So
Okay.
there are many disorders for which autism or autism spectrum like features could be one of the clinical components. For example, say tuberous sclerosis. It is a multisystemic disorder. It is monogenic. Manifestations are behavioral changes which cover this autism spectrum, seizures, developmental delay, neurodevelopmental issues. There could be risk of malignancies and so on. And again, being autosomal dominant, though these could be de novo, there it is inherited in autosomal dominant disorder. There something known as reduced penetrance. That means like parents are having the same mutation, but they have
Sorry,
very
I lost
minimal
you on that. Something known as?
reduce so something known as reduced penetrance. That is, the parents also have the same mutation, but they have very mild or minimal symptoms. So doesn't manifest much in the parents, but in the child the symptoms are severe. So particularly in such cases, it is difficult to predict the phenotype in the next generation. But definitely, if the mutation is found, we can do prenatal testing. So testing in the next pregnancy, what we call as prenatal diagnosis. So summing up the genetics of autism, studies have shown like if you have a cohort of say 100 children affected with autism, about 5% have some chromosomal abnormalities which can be detected by cytogenetic studies such as karyotype. About 15 to 20% have some copy number variations, submicroscopic, which are not detected by cytogenetic studies. This is detected or tested by microarray. That's another platform of genetic testing. And in another 5 to 8%, it could be monogenic or single gene disorder. So grossly, we can say about 20 to 30% of cohort, 100 cohort of autism, they have some genetic aspect to it. And in rest, it could be still genetic aspect could be there, and along with that, it could be environmental factors and other factors, what we call as multifactorial inheritance. So genetic component is there, it is significant, but it is not very strong enough to manifest the disease by itself. So in when we talk of autism, the genetic aspect or component becomes very important, and particularly in that cohort where it is one-to-one correlation. Okay, if this genetic abnormality is there, this disorder is going to happen and autism is going to happen. In that cases, diagnosing the disorder at the molecular level is important. Now, why diagnosis at molecular level? Because if a genetic abnormality is known, a disease is diagnosed, then based on this genetic abnormality, we can provide an option of prenatal diagnosis or testing in next pregnancy, so as to find out whether the child has the same mutation and risk of having the same disorder. In this case, we are talking of autism, right? But in those situations, like if we do the genetic testing, what we have discussed earlier, the reports come out to be negative. In those situations, the risk of recurrence of autism in next pregnancy is less. It varies between 3 to 7% across various studies. So though 3 to 7% could be significant for some, but compared to monogenic disorders or other genetic disorders where the risk is, say, autosomal recessive type of disorder, inheritance pattern is there, the risk is up to 25%, or say tuberous sclerosis where the risk could be up to 50%. So that is very high. So compared to that, in such cases, the risk is less. It is about 3 to 8% across various studies.
Sir, I would request you to take a bit of pause here.
Mhm.
As a medical personnel, I could relate to some of what you have said
Mhm.
because it's very complex for me too.
Okay.
But to make it easier for um, other population of the viewers who are not from medical background, just to simplify,
Okay.
because
Okay.
what you said was really insightful. Even I did not have an idea, being a autism mom myself. So to simplify it
Okay. Okay. So
for,
let's
yes,
start it all over again. Okay. So when you are talking of
to
this,
simplify, just to make us understand
got it.
what
Got
role
it. Got it.
genetics has in the causation of autism.
Right. So when you are talking of genetic causes of autism, roughly you can say about between 1/4 to 1/5 of cases of autism, they have a pure genetic cause which can
Okay.
be tested for. There are different ways of testing it. There are different levels of test. In simple to simplify, you can call them at as low resolution, mid resolution, or high resolution genetic test, depending upon the resolution at which they look at the genome, right? Like if it is looking at the chromosome or the DNA level. And in these cases, if we do a test and if we find a genetic abnormality, what we call as mutation, right, in this 1/4 to 1/5 of cases,
Hmm.
then this one to one association is there. So which helps us to do genetic testing in next pregnancy so that we can see beforehand if the next child that is going to be born, is it going to be affected with the same features as the previous child with autism.
Yes,
Right.
that
So I
was
just want to,
precisely my next question, because most of the parents I interact with, they are already planning their second child or in process of that. So all the time they have this constant, I wouldn't say fear, but uh, constant thought: can my next child be an autistic as well? Or are there ways to know that if uh, the in utero, I mean prenatal test, if they are available?
right. To know whether a child has a genetic component which is, manifesting as autism, there are certain clues that we look at when we examine the child as a medical geneticist. So to name a few, are there any, neurocutaneous markers or skin patches, say dark skin patch, light skin patch? So these are certain clues. Or particular or peculiar appearance of a face, we look for dysmorphism, unusual appearance of a face. Or symptoms like, along with autistic features, if a child has, say, epilepsy or seizures, or there is a developmental delay which is just not restricted to language domain but affects motor as well, but may not be that significant compared to language. Or is there a stereotypical pattern of behavior, like, say, flapping of hands, clapping,
Hmm.
repetitive behavior, what we call? So these clues point to respective or a group of genetic disorders which
Hmm.
may have autism as one of the features.
Okay.
So
Okay.
this helps us to identify whether this, so this is one of the few clues that we look at, definitely autistic child must be examined and evaluated by a medical geneticist. Okay, that is important because that is how we look at it. Proper examination, and if required, certain blood tests or imaging tests may be necessary at times. This helps us to narrow in on a provisional or a clinical diagnosis, and based on that diagnosis then we look at the genetic test that needs to be done. So this is important because depending upon the genetic disorder that we are thinking of, the test that we want to request will differ. There is not a
Okay.
single, it's not like a single genetic test will cover all the genetic disorders. The underlying
Mm-hmm.
abnormalities differ, underlying mutations differ for those tests, for those genetic disorders, and the tests to pick up those genetic abnormalities are different. So until and unless you know what you are looking for exactly, you won't know which test to order. So that, and again, this is important because tests are costly and time consuming. So this homework
Time
is
consuming as in?
like, say if I do a karyotype test, it will take a few weeks time, right? Karyotype, like looking at the chromosomes. If I'm doing certain test for say Fragile X, the report will come in few days. If I'm doing a microarray test, again maybe a week's time, week to 2 weeks. But if I'm doing something like a next generation sequencing test or a exome analysis test, for that it may take about a month to 2 months time. So, and again costs involved. So this is important. Otherwise, what will happen? We end up ordering a test which is not going to pick up the abnormality that we are looking for, right?
Yes, yes.
So it is like your car is not starting, right?
Hmm.
You are looking at the petrol tank whether the tank is filled or not, but the actual problem is in the spark plug or starter.
Hmm. Hmm.
So you should know what all things to look for, when to look for. So like if when you're
Okay.
putting the key in the car and the starter is getting on, you know that the battery is in place, spark plug is working, starter is working. And if these things are clear, then you look at other things. So I know maybe is it the petrol tank that's empty, or is there a fault in the engine? So that is how you should know what you're looking for, what you want to look. Based on that, you'll order the appropriate test. So
Got
this
it,
was
got it. Yes.
regarding the genetic testing or workup for the child who is affected with autism, right? So if we have anything positive in the report, or we find a genetic abnormality which is showing, okay, this abnormality is causing this disorder because of which autism is there. So there are very few conditions where autism per se is the manifestation of that disorder, like say Rett syndrome, where girls have this
Yes.
autistic features, or say Fragile X,
Hmm.
right? But such conditions are very few. Most of the genetic disorders, they have additional component, growth retardation, failure to thrive, another neurocutaneous markers will be there, dysmorphism will be there, microcephaly will be there, like small head size and so on. So for such conditions, then the prognosis or how the disease is going to behave or how the child
Hmm.
will progress, it varies, right? And
Right.
then the genetic diagnosis becomes more important, because once you've found the mutation, you know the disorder. So then based on the genetic abnormality that has been found, you can plan testing in the next pregnancy. So just to stress it again, only in those situations where a genetic abnormality is found at the level of DNA or a chromosomal level in a autistic child, only in those cases we can offer testing in pregnancy for that condition. Otherwise, it is not possible to test because we don't know what is leading to the autism in the child.
Okay. Okay. Uh, that is definitely going to help one of the parents. So the firstborn is autistic, and they already have planned a second child,
Right.
and she is, I guess, in her 12th, 13th week. So 2 weeks back, she had called me and asked for how can I test for, if at all there is any test, to understand the in utero, I mean inside the fetus, inside the
So,
uterus, the status. So
so
can
this is
that
this
be
is
done?
yeah, this can be done. Now there are few points which are very important, which we should note, because this information is not very clear among the doctors as well, doctor community as well. So the point I want to stress and highlight here is, for any family who has a child with, say, autism or say any other genetic disorder, right,
Hmm.
they should differ from planning next pregnancy until and unless a genetic diagnosis is made in the firstborn affected child. That is very important. The reason is, once you're pregnant and you come, and then we start testing for the child to look at the genetic abnormality, we are racing against time. Because in pregnancy we have a window within which we have to do the test, find out the reports, and based on that you want to take a decision, right, whether to continue or whether not to continue. And again, all this is governed by the PCPNDT rules. That is very important.
Yes. Yes.
So if we get the reports in time, you can take appropriate decisions. But if that doesn't happen, then it's very difficult situation there. So my sincere advice to all such families who have a child with, say, autism or any other genetic disorder, and who want to plan for next pregnancy and want to know or want to be sure that such cases do not recur in next pregnancy, it is very important that I think I lost you.
Thank you, sir. This has been very informative and very new for me, as well as I'm sure most of the parents and the healthcare professionals. So, I would like to understand it from you. If someone goes for this test, as you said, ordering this test, so what is the accuracy if someone goes for it?
Right. So, as I said earlier, most important is diagnosis or finding the genetic abnormality in the affected child. So, if that is found, the genetic abnormality is found in the child, then in those particular families, when they are planning pregnancy, in all of those pregnancies, we can do a prenatal diagnosis or we can test for that particular abnormality and see if the child is going to be affected or not. So there are two ways of doing it. One is between 11 to 13 weeks, what we call as chorionic villi sampling.
Mm-hmm.
And another is after 16 completed weeks of gestation, what we call as amniocentesis, garbhajal parikshan.
Okay. Hmm.
So depending upon the gestation, the couple in conjunction with their fetal medicine or treating obstetrician, they can decide what or exactly when they want to do the test. And from the samples obtained, either a CVS or amniotic fluid, we can do the genetic test. So again, the point I want to highlight is the genetic diagnosis in the affected child should be there, right? Only in those cases we can proceed with testing in the pregnancy. So workup of that child should be completed prior to planning pregnancy. Otherwise, you are racing against time. Otherwise, you won't be
Hmm.
able to provide the testing option in the given window, because once you do CVS or amnio, after the samples have been collected, for the reports to come, it takes some time, up to 3 to 4 weeks. So we require that window. Otherwise, then PCPNDT rules are there, which must be strictly complied to. Then it becomes difficult.
Okay. 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 So, to summarize that, it depends.
Right.
The accuracy of the test depends on various
No,
factors.
see, there are things, I think, two different things when you're talking of accuracy of genetic testing. So I think you're referring to testing in pregnancy, is it?
Yes. Yes.
So for any genetic disorder or abnormality that is diagnosed in the family, if it is inherited or there is a previous child who's affected, and the genetic abnormality, if it is known, the same can be tested with 100% accuracy in the given pregnancy by CVS or amnio. For example, suppose there is a child affected with Rett syndrome, we know the abnormality. Suppose there is a child with, say, Duchenne's muscular dystrophy, or any monogenic disorder, some enzyme deficiency, or skeletal
Mm-hmm.
dysplasia, for which the genetic abnormality is known. Right. In such cases, with 100% accuracy in
Oh,
pregnancy, you can do the testing. So that accuracy is 100%.
okay. 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 Thank you, sir. Thank you so much. That would help many of the parents who are watching us today. And since, as I understood, this tests are available, as per my knowledge, only at metros. I mean, metro cities. And so, if someone is from interior of India,
Yes, yes.
so how can they contact? Where should they contact?
See, definitely the larger labs are located in metros, that is, we all know. But the good thing is that, like, for example, say SRL labs, Lalpat,
Yes.
they have collection centers in periphery. SRL is present everywhere in India. So
Yes. Yes.
getting a genetic test done even at a periphery is not an issue. That is one. Logistics is not a problem, sending a sample to SRL lab in Mumbai. What is
Okay.
most important is getting a proper genetic consultation and evaluation. So there is a difference between genetic counseling, genetic consultation, and a psychological counseling. So as a medical geneticist, we see the patient, we examine the patient, we make a medical diagnosis. Right. The part of the genetic counselor is to counsel regarding the disorder, counsel regarding the risk of, inheritance, recurrence. If any procedures are going to happen, say amnio CVS, to counsel regarding that procedures, the risk, the outcome. Or say if there is any patient for hereditary cancers, to counsel regarding that risk. So the counselor's role is to facilitate the test, to interpret and make the patient understand the reports. So it's more of counseling, the talking part, right? Facilitating the test and getting the giving the reports. But the role of a medical geneticist is much more: diagnosis, evaluation,
Mm,
which test to do,
mm.
when to do, then getting the test done. Once the reports are there, interpreting the reports even before sharing the reports with the patient. So this is much more complex, right? So as a doctor, so these
Yes.
medical geneticists are doctors. So you have to know about the disorder, you have to know about the etiopathogenesis, you have to know about the epidemiology, as well as the complications and implications that are there for particular disorder, and then facilitate everything.
Okay, okay. Thank you, sir. That has been very insightful. And I also understand it is already 11:15 and I have taken a lot of time of yours. But at the same time, I would like to request you to come back to our platform again, because I'm sure there are going to be a lot of questions on this once we release this episode. And if at all someone wants to go for your consultation, then where to
So
contact and how to contact.
Yeah, so I'm
I shall be
available
adding
at.
that information in my description box, definitely.
Okay. So for consultation in person, I'm available at Mulund Fortis, Mumbai, on Tuesdays and Fridays between 2 to 5 p.m. Right. So you can
Okay.
get the number from Google for Mulund Fortis, Mumbai. And rest of the days, I'm
Okay.
at SRL Lab, Goregaon West.
Sure, sure, definitely. That would be very helpful for those who want to get in contact with you.
Right.
So, thank you so much, sir. Today we got to hear directly from horse's mouth the celebrity authority in this topic. And sir, we are looking forward to interact with you again with the details which would make us understand it more and in simpler language.
Definitely looking
Because
forward.
those
So I think I have a cab to catch in the morning for Madurai. Today I'm in Coimbatore. Tomorrow I'm in Madurai. So today it was cancer genetics. Tomorrow it is neurogenetics. So I'm shifting
see,
gears like anything.
see, I told you, you are a celebrity authority. And
नहीं
thank
नहीं
you so
thanks to
much.
same here.
Thank you so much for being here for us and being here for me.